Welcome back to Breakfast Daily on City TV. Send your messages using our hashtag Breakfast Daily, or you can WhatsApp us on 0550 585832. Now, January is actually Cervical Cancer Month. Some of you may call it cervical cancer. Cervical, cervical is the same thing. It concerns the cervix. And cancer of the cervix is what we're going to be discussing today in this segment. Now, I'd like to welcome Dr. Anita Thibault, who's a resident of Family Medicine, Department of Family Medicine at the Kolebu Teaching Hospital, and she's a member of MWAG, and she'll tell us what MWAG is, or MWAG, and Dr. Miriam Waku Coleman, Public Health Physician and President of MWAG, the Medical Women's Association of Ghana. Welcome to both of you.
Thank you.
Thank you for joining us this morning.
Yeah.
Okay, so for people who need a bit of education, let's do Cervical Cancer 101. What is cervical cancer?
Okay, so like you said, cervical cancer, January is Cervical Cancer Awareness Month. And when we are talking about cervical cancer, we are talking about cancer of the cervix. So the cervix is simply the mouth of the womb. So where the womb enters the vagina, you have the cervix, which is the mouth of the womb. So cervical cancer is cancer that affects that area.
Okay.
Yes.
Now I notice you have a dummy here.
Yes.
So just to educate people, if they can look at it, show us where the cervix is.
Okay, so looking at this dummy, this is the vaginal opening. So when you go into the vaginal opening, you have the uterus. The uterus is somewhere in the pelvis. And so the cervix sort of gets into the vaginal opening. So when you go into the vaginal opening, then you go to the cervix. So the cervix is at the top of the vagina, and it looks somewhat like this. So it has the opening, which is the opening into the uterus, and then the neck of the cervix.
Okay.
So that's what it looks
So
like.
basically this circle here
Yes.
goes
That is the
into the
cervix.
that is the cervix.
Yes.
Okay. Now, when it comes to cervical cancer, what exactly causes it?
So it's caused by a virus, which is the human papilloma virus, and it's a sexually transmitted infection. Yes. So most of the time, most sexually active adults are going to get the virus at any point in time. Once they start.
Okay. Pause. Let's do that. Let's take that again. Now, you are saying that, because a lot of, we hear about cancer, whether it's breast cancer, lung cancer, we know that there are some things that increase your risk factors, but you're saying this particular one is directly linked to sexual activity and the HPV.
Yes. So it's so the virus is sexually transmitted. A normal person who gets the virus is able to clear the virus.
Okay.
Yes. So it's like a typical infection, like a normal cold. You get the cold, it goes away, you are fine. For most people, you will get the virus, your immune system is able to clear it, and you'll be fine.
Okay.
But the thing is, once you get recurrent infections, so as you keep on getting recurrent infections, so getting risk factors such as multiple sexual partners, or having sex at a very early age, or being immunosuppressed in some way. So maybe you have pre-existing malignancy, or you have a disease like diabetes, or you have other sexually transmitted infections. All these things increase your risk factors of not being able to clear the virus. Yes.
Okay, so young women.
So very young women.
Women who have multiple sexual partners or are very sexually active at a young age.
Or their partners have multiple sexual partners.
Oh, ho, ho, ho. Be careful who you copulate with.
Yes.
Because you need to protect. That's why protection is important.
Yes.
Wear a condom, guys. Okay, women, be careful of yourselves. Okay, so all right, let's get a bit more into the detail. How do you even know if you have cervical cancer? Are there any symptoms that you might feel to give an indication that there's something wrong?
Okay, so in the first place, when you get the infection and you are not able to clear it, it's going to take about 10 to 15 years before you can eventually develop the cancer.
Years?
So yes, so you can be asymptomatic for 10 to 15 years. Then after that, you can have symptoms like pain during sex, abnormal vaginal discharge. So when we talk about abnormal, we are talking about maybe an excessive vaginal discharge, or it's offensive, there's a very bad smell, or it becomes bloody when it shouldn't be bloody. So it's not time for your menses, but you are bleeding in between your menses, or you are bleeding after sexual activity. All those things can point to the fact that you have cervical cancer. If it's advanced, you can actually have problems with urination, problems with defecation, persistent pelvic pain. So all those are symptoms of cervical cancer.
Is there a way to prevent this? I've heard a lot about some vaccines that women can take. Is that something that's an option for women here in Ghana?
So yes, it is an option. However, it's not a national policy. Yes, and it's quite expensive. So a lot of people are not able to access it. Yes, on a large scale. But the vaccine is available.
It's available.
Yes.
Okay. What about treatment? So if sorry, you wanted to talk about the vaccine.
So I wanted to add to that with respect to the prevention. Again, Anita has said that cervical cancer gives you time.
Yes.
10 to 15 years.
Yes.
If the virus is not cleared before it causes changes in your cervix to become the cancer. So you have a long period where if you are screening, you can catch the cancer early. Before you get all those bad symptoms that she talked about, at which stage it's pretty bad and a lot of people die because it's advanced cancer. So that's why we are making this noise, because lives can be saved if we catch it early. With just regular screening, looking at getting your cervix looked at, checked, we can catch it early, and if it's very early, kill it before it gets done.
This table you're shaking it, please shake it harder. Look, I meet a lot of young women who say they've never been to a gynecologist. They're afraid to go and see their gynae. They're afraid of having a pap smear. Oh, why do I have to go? Oh, some will say, oh, I don't really have sex that much. Or, okay, for a virgin, maybe a virgin, because they're not having sex, they might not be at risk. I don't know if that's the case.
Yes.
So, but for people who are sexually active, I know a lot of women who say they've never been to a gynae and they're afraid to go, or they're uncomfortable, or they feel fine. They don't see the reason to go if they're not.
A couple of reasons.
Okay.
Comprehensive sexual education in our schools. We just touching it on the tips, not teaching people what they need to know about their body and be confident about their body to the extent that they want to protect it and keep it healthy, so that they would want to do the regular checks as is necessary. That is one, the education to make people aware. The second thing is cultural. And that's one we need to, it's all part of what we're doing. Need to let the woman know that there is nothing wrong for you to lie down for an expert to check if things are right or going wrong. That is the essence. And goodness me, Kopi, we're doing all sorts of things.
All sorts of
and if you have opportunity, we can talk about sexual activity.
You have to talk.
So why not an expert to just check you out? So if nothing is wrong with me, why should I go and lie down for a man to look at me? But let's have it in our mind that it is for you to protect yourself.
Okay.
And it's an education that needs to go on.
It needs to happen.
Yes.
For people who maybe are a bit skeptical, they think, oh, it's not a big deal. Give us some numbers. How, in Ghana, for instance, what are the statistics like for cervical cancer?
So cervical cancer is actually the second most frequent cancer amongst women, and it's the number one killer amongst cancers for women in Ghana.
Number one?
Yes, amongst cancers. It's the second, yes, second to breast cancer.
But
yes,
it's killing
women. Yes, more women. And also, if you look at women in the reproductive age, that's women between 15 and 44 years. That is the most diagnosed cancer amongst them. Yes.
Wow.
And in a year, you can have about 3,000 new diagnoses of cervical cancer in Ghana, and you have about 2,000 deaths.
Out of that 3,000?
Out of that 3,000.
Whoa. Because they're coming late.
They don't get screened.
We have work to do. Okay. So what are the screening tests that are available for women? Let's start there.
Okay. So for screening, there are three basic types. So we have the HPV DNA testing.
Okay.
So for the HPV DNA testing, you could have the liquid-based cytology testing. So we have the pap smear. And when we do the pap smear, we take some tissue from the cervix and then examine it under a microscope.
Okay.
But then when we do that, we can also do DNA testing on that sample to be able to detect the HPV virus.
Okay.
Then aside from that, we also have the HPV blood test. So you can do a blood test to detect HPV.
Okay.
Yes. Then there's also the visual inspection methods. So those ones, you have your normal pelvic examination. We look into the cervix, we look into the vagina and look at the cervix, and we can detect certain changes based on certain chemicals that we can apply. So the most commonly we use here is acetic acid, which is common vinegar. So we apply some vinegar, and then we can see some changes, and from there we let you know what we can do.
Okay, we'll take a quick break. When we come back, Dr. Waku Coleman will tell us about what the Medical Association of Ghana is doing to spread the word and make more noise about Cervical Cancer Month or Cervical Cancer Month. Don't go anywhere. This is Breakfast Daily on City TV.
City TV is live on DSTV. Go to channel 363. On GoTV, access City TV on channel 182. On a digital TV, please press the menu button on the remote control and run a new search on your TV. Take note that without an antenna, you cannot access City TV on your television. City TV can be accessed on a free-to-air digital box like the GoTV and StarTimes box. City TV, it's your world.
What's cooking? How about finding new ways to use your favorite ingredients? Just cut across like this and then bring it down this way. And then you have your diced onions. Very simple. Take your meals to the very next level. AJ, see, on this one, just putting a tiny bit of the
Oil. Oh,
yes.
so
this is the mixture. So this is the mixture, the coconut oil and the...
Okay.
Join me at Pioko on What's Cooking as I tour various kitchens to bring you new recipes and delicacies.
Oh, what's that?
And table. Honey.
Yeah, give me some honey.
Oh, you want some honey? Oh, okay.
Yes. But there's sugar already. It's a blend.
Watch What's Cooking right here on City TV every Tuesday at 7 p.m.
What's Cooking is sponsored by Fortune Rice. Fortune Rice, always on point, just like mom. Indomie Instant Noodles. Indomie Instant Noodles tastes great. Sankofa Natural Spices. Didier Bibia ye natural.
Welcome back to Breakfast Daily. I'm still here with Dr. Waku Coleman and Dr. Thibault, and we're talking about Cervical Cancer Month. So, Doc, tell us about what activities you have planned, the Medical Women's Association of Ghana, to highlight Cervical Cancer Month.
Okay, thank you. Cervical cancer is very important to us as Medical Women Association of Ghana. We believe that that is something we should champion to save the lives that could be saved from cervical cancer. And so, like we do every year, the focus really is to create awareness, because we realize that that is very small in the population. And we are happy to say that there's been improvement, but there is still a lot of work to do. So we're going around every part of this country. Lady doctors are going around, like we've come here to radio and TV stations. We are going to schools, we're going to churches to educate people and to let them know that there is something called screening. And the next thing is that we're also encouraging people to screen. And we're actually providing free screening services in some parts of the country with the support of Lexter, who produces YAS.
Lexter,
Yes, so they produce YAS sanitary towels, and for every YAS that pad that you buy, some amount goes towards cervical cancer.
Fantastic.
So they are supporting WAG greatly, and we are very grateful to them.
Awesome.
And for this year, we're doing the launch at Pram Pram next week.
Oh, wow.
We are going to talk to the community about the disease and how they can prevent it. And we also conduct free screening for 100 women, so that to let the people know that this is something that is useful. And over the years, as we've done this, we found some positive cases that we have referred for further treatment, and they are doing well, and that is the idea. So we believe that as we go to the community and we do this, it will catch on, and as we continue to do this, people will become aware. They will do the screenings. VIA pap smear every 3 years. Once you do it and you are fine, you go about your business till the next 3 years.
Good.
If there is a problem, your doctor will put you on a schedule. Sometimes we need to follow you. It's not full-blown cancer, but we need to follow you. If you do the HPV DNA, 5 good years. And then if you have a child who is between 10 to 15 years, boy or girl, as Anita said, it is not yet a national policy, and that's an opportunity to advocate to our leaders to consider this.
Boy or girl, because the virus can affect either, and the boys can transmit it
to us,
and the girls can.
So let them take the vaccine. It's in Accra, Kolebu, the reproductive health unit. It's in Akai House. It's in Kumasi. It's in different parts. As we said, it's expensive, but it would save us.
Okay, how can people get in touch for more information?
If you want to, just please call 0244 623 553.
Okay.
0244 623 553. Just say cervical cancer. Even when we are sleeping,
you wake up and answer the
call.
All right, fantastic. Yes. Thank you so much, Dr. Marco Coleman.
Thank you so much, Siti, for the opportunity.
We always need good education on things like this, all right, to protect our health. As always, if it's detected early, it can be treated, and your chances of survival are much, much higher.